Okay, so what is Hashimoto's thyroiditis?
Hashimoto's thyroiditis is a condition in which the person has hypothyroidism, but they also have an autoimmune disease in which their antibodies attack the thyroid gland. There's a lot of inflammation that happens at the area of the thyroid gland, but inflammation can also occur in different parts of the body, causing aches and pains, the joints, the muscles, and such as that. How do we treat Hashimoto's thyroiditis? Of course, we're going to give medication according to the patient's symptomology and their blood test reports. But the other thing with Hashimoto's is that the patient will have to stay away from gluten as much as possible. And reduce the amount of stress in their life. Stress is a big problem with Hashimoto's patients because it does affect their antibodies.
Okay.
And so when the stress goes up, the antibodies levels go up, and thus the symptomology also increases as well.
I know in your chapter on hypothyroidism in your book, you give the example of a school teacher who's your patient, whose stress at the beginning of the year exacerbates her Hashimoto's. Can you talk about that a little bit more?
Okay, so stress is different for everybody because stress to one person may not be stress to another person. So it's not only the job or the kids or volunteering for too many different things that can cause stress, but also when your body's not feeling well, that's a form of stress. And so when we have the example, as you quoted, with the school teacher. So I do see quite a number of school teachers in my practice here and with Hashimoto. So during the summer, we hardly ever hear from these school teachers. They're on vacation. Their stress level has decreased. When they start school in August or September, the stress levels go up, and I start seeing more patients in my practice here during that time with an exacerbation of Hashimoto's. So the stress, this is just a perfect example how stress can affect Hashimoto's thyroiditis. So we have to make medication adjustments according to their stress levels and their symptomology as well.